So what are some main things, like say moms are pregnant right now listening, that they can kind of prepare for to kind of not go that way, make it sure it's like it is the last resort?
One of the things I think that makes my birth courses really different is we do weekly check-ins, weekly coaching calls. We actually call it the happy hour. And so we meet weekly, both courses separately. Each course has a weekly happy hour, and we talk through things. So last night, funny that we're talking about this now, last night we were talking about communicating with your provider. And I don't want any of my students going in willy-nilly, like, I will not do this, I will not do that. I want them to understand why. Why do we do cesareans? What is the reason? And when is it valid? And when is it not? And the only way that a mom can know that is if she has, so I call it your labor tool bag. If her labor tool bag is a solid bag with a solid foundation. Like we all know when you buy a handbag, like if you buy a cheap handbag, you're setting yourself up because it's not going to last. So the foundation, the lining of your tool bag needs to be education. Education is power. I know it's overused, but it's true. But taking it even a step further is education is power when it's applied. If you have that knowledge and that education, but you're too scared to speak up, you're too scared to question your provider, then it's not really power per se. So what I do is I teach my girls, okay, this is the intervention, because the truth of the matter is once you start having interventions, it's a cascading effect. And so if you can stop it in the beginning, that intervention, then you may not end up here at this intervention, including a cesarean, which is like the last resort intervention. And so I teach them how to ask clarifying questions, how to understand, okay, is Pitocin really needed in this circumstance? We weigh everything by curiosity and convenience. So are they wanting to do Pitocin because maybe my labor's not going as fast as the doctor wants it to? But I'm in good health, my baby's okay. So why does it matter if I take 6 extra hours? Doesn't really matter, because if my body does it on its own, it's going to be much more effective and safer for me and the baby. So we start back then. You can't just start at, oh, I'm not going to have a C-section, or why is the C-section? You have to start way back at the beginning at your choice of, do I go to the hospital when I first start laboring? No, you don't. Because as soon as you get to the hospital, guess what? We're going to start intervening. We're going to start an IV. We're going to put you in bed. We're going to strap you to monitors. We're going to limit your movement. Well, movement is key. Movement is really important. So I try to teach them way back at the first steps, like what can we do to not end up here? On the flip side, I also teach them the signs that a cesarean would be appropriate. So they have to have a knowledge base to be able to go in and make, because if you don't have a knowledge base, you're going to have to lean into someone else to make decisions for your birth, and decisions are going to be made, period. Someone's going to make them. And if you aren't knowledgeable, of course, you're not going to make a decision. You're going to let someone who is. Well, I hate to break it to people, but we're all human and we're all people, and your provider and your labor nurse, they have preferences. They have the way they like to do it and the way they see it and how they want it to happen. So if you aren't knowledgeable and the captain of that decision, then someone else will be, and their personal preferences will play a part in that.
Yeah. Wow. I love that, because that you said that, because like I said, I interviewed someone a couple years back, and she was talking about how, in the moment she just remembers the doctor kind of coming in and saying like, we need to do a C-section. And then like afterwards, just kind of being like, wait, what were my other options? What is a C-section? Like she didn't really fully understand it. So the fact that you're doing all this education for women is so powerful, just to understand what's happening to their body, understanding like, okay, what are our options, and being a voice for them that kind of helps them.
Yeah. And it's not my voice, it's their voice. That I interviewed one of my students. We did a birth story, and she said, I loved how she put it, because if anyone follows me, they know that I have my own personal preferences for birth.
Mhm.
I love unmedicated birth. I love moving around and doing it myself and all of those things. However, what I do is, and this is how she said it, is I lay out all the options like a smorgasbord, and then you pick what you want.
Mhm.
And it's so mom is picking, no one else is picking, not Trish and her labor course, not the provider, not the
Mhm.
labor nurse, not the hospital policy. All of those things are wonderful and can help guide you, but ultimately it should be her.
Mhm.
She is the center of the birth. And so
Yeah.
she should make the decisions, but she has to have knowledge to be able to do so, because it is a, it is a pretty important decision making process, and like you said, sometimes it's as simple as, well, what are the other alternatives? Like, you want to do a
Mhm.
cesarean, what's the benefit and what's the alternative?
Mhm.